Hi, I'm Laura Kinsey. I'm the head, neck and thyroid nurse specialist here at the Trust.
And I'm Laura Olds, one of the specialist dental nurses. We are here to tell you why mouth care matters to us. What are the percentage of oral cancers?
Head and neck cancers are the 8th most common cancers and equate to 3% of all cancers.
What causes oral cancer?
Smoking, alcohol, diet, so lacking vitamins and minerals, HPV virus, excessive sunlight, age and gender.
By smoking, you're 10 times more likely to develop mouth cancer. More than 6% of mouth cancers are linked to smoking.
Alcohol is linked to just fewer than 30% of all mouth cancers. Smoking and drinking together combined increase the risk of mouth cancer by up to 30 times. How many people don't have a dentist?
50% of adults and 41% of children do not have an NHS dentist.
What does your mouth tell you about you?
What colour is it? Is it pink, red, yellow or white?
So pink is healthy. All the soft tissues, including the gums, should be pink and moist. Red equals unhealthy. Any soft tissues that appear red need attention, as this could indicate that there is an infection. Yellow and white coatings. This could indicate thrush or just coating, so more attention needs to be made to the tongue and a mouth swab scent. Any of the colours other than pink are not normal, and this could indicate a problem for your patient, such as reduced taste, smell, appetite, increased risk of developing further infections within the body, which could increase the risk of developing sepsis.
Why is it more important for those having chemotherapy and radiotherapy, not just from head and neck cancers?
So it increases the risk of infection because of lower immunity, so you can become neutropenic. You can develop mucositis, which can be induced by chemotherapy and radiotherapy or a combination of both. You can potentially cause other health conditions such as endocarditis, pneumonia and prolonged stays within the hospital. What is mucositis?
Mucositis is the inflammation of your digestive tract affected by chemotherapy and radiotherapy. It can be severe enough that patients may require enteral feeding.
With head and neck patients, this is further complicated by the drier mouth, thicker saliva, altered taste due to radiotherapy, damaging the saliva glands, which increases inflammation and pain and resulting in poor nutritional intake. Closer to 100% of all patients develop mucositis of some degree. How to check your mouth?
Look in a mirror and stick out your tongue.
Number 2.
Examine the upper surface of the tongue for any unusual lumps or obvious changes in colour.
Number 3.
Pull the tongue forward and examine both sides for lumps, bumps and masses.
Number 4.
Examine the floor of the mouth by placing the tip of your tongue on the roof of your mouth.
Number 5.
Examine both cheeks, looking and feeling for white or dark patches, ulcers and tenderness. For any inpatient, staff on the wards can refer patients to the Max Facts on Call via Maxims for urgent dental advice.
What can you do to help?
Encourage oral hygiene, provide the patient with toothbrush and toothpaste. If the patient has dentures, take them out and clean them regularly. Promote good hydration, and if the patient is struggling to eat, ask if they have pain, discomfort when eating, and change your toothbrush regularly, at least every 3 months.